I'm at the Energy Psychology Conference and I have the pleasure of talking to
Dr. Judith Swack.
Doctor, what area of specialty are you involved with?
I consider myself a mind-body healer, mind-body therapist. My background is a PhD in biochemistry and years of postdoctoral training in human immunology. And I was interested in the mind-body connection and mind-body healing, so I took my scientific mind into the area of mind-body therapy and developed a healing methodology that works reproducibly on many different problems. What I presented at this conference was a protocol for treating PTSD, post-traumatic stress disorder, and I was able to come up with a protocol that's reproducible and that removes all the symptoms in 1 to 6 sessions. And I published in Dan Benor's International Journal of Healing and Caring Online some of my studies.
What are some of the common negative emotions that people have when they have traumas?
Well,
and
of
that
course,
you were very successful with?
Yes. Well, first of all, the symptoms of PTSD are things like insomnia, panic attacks, anxiety, depression, alcoholism, addictions. It's a very miserable way to live. And the people that I treated had been suffering from those symptoms for up to 60 years. And then really 1 to 6 sessions later, they were symptom-free.
Now, I understand you deal with like history of traumas, so you don't deal with, say, someone who just had like one simple trauma, but someone has multiple traumas, known as a history or something like that. Can you explain?
Yes. Well, I do treat people with individual traumas, but it occurred to me that PTSD was probably caused by a series of traumas. So a history of traumatic experiences, as it were, that stacked up in the body as unprocessed negative emotion because people who were experiencing trauma didn't have the techniques or tools to release it from the body. So at some point, the nervous system reached its limit and they experienced one more traumatic experience than they could really handle. And their nervous system basically shut down. And within 24 to 72 hours later, they started having symptoms of PTSD, including, as I said, panic attacks, insomnia, even tremor, and, nervous problems. So I realized that something really special happened at that moment where the straw that broke the camel's back. And I looked at that very closely, and I realized that as a protective mechanism, the unconscious mind blocked the conscious mind's ability to access the body memories of that stretch of history. So people with PTSD will say things like, I don't remember much of my history before the age of so-and-so. Or I'll ask them to write a biography, and they'll have a phobic reaction to writing their biography. They won't write a biography, and they'll make an excuse why they didn't, not realizing that they had resistance to it.
They're blocking it.
Blocking.
Because it was too painful to recall.
Too painful to recall. So I realized that probably the easiest way to treat this without re-traumatizing the client was to treat the part that did the blocking rather than try to get into the history. So I developed a protocol that worked very successfully. The approach is you ask the client where in your body is the part of you that cannot bear to think about that stretch of history. And they'll say it's in my heart or my throat or my stomach or what. And then I'll say we're only going to talk to that part. And I make a motion that their history is over here in the distance so that they don't fall in.
You separate it.
I separate it so they don't have a chance to re-traumatize. And then I start talking to that part, and we do muscle testing to get answers from their deepest wisdom. And we muscle test and ask that part directly, when you think about that stretch of history over there, far away, do you have any shock or fear when you look at that stretch of history? And that part of them will say, yes, I have shock and fear. And then I'll ask, where do they feel the shock and fear in the body? And it might be in their head, it might be in their jaws, teeth clenching, right? It might be in the back of their neck, this kind of thing. And as a matter of fact, I had a lawyer come to see me who had been bullied very unmercifully, both from his stepfather and kids at school growing up, and he never expressed his anger about it. and at the age of 65 or so, his body turned into pain. His entire body went into extreme pain. And it turns out he had persecution or bullying history trauma. And so we actually asked, where's that part that can't bear to think about your history? And it was his whole body clenching. His whole body clenched. So we treated the clenching reaction. And the techniques that we use are from energy psychology. So meridian tapping techniques like EFT, where you tap around here, or Hui, where you hug yourself and tap alternating on your biceps, and or JMT technique, Jaffe Malor technique, where you tap down the spine while the client breathes in, breathes out, puppy pants, just to release the trauma memory from the autonomic nervous system and drain all the built-up stress that's really stuck in the body. So when we have a trauma, not only do you have shock and fear, but this part, when it looks at that stretch of history, also feels anger and rage, do you think? And hurt and pain. No surprises there. Sadness and sorrow, right. And then it could have shame and guilt, right? And feelings that whatever happened there was my fault, or it was other people's fault, or it was God's fault. Now, if they look at that stretch of history, and this part of them feels that because of that series of experiences, they lost really important aspects of their life, like their sense of safety, or their sense of self-confidence, or their ability to trust, or their childhood. They felt they lost their childhood or their joy, because depression is a major symptom of PTSD. Then, we treat for recovering those feelings that they lost. And what's really interesting is on a loss trauma, after you do the major emotions, you have limiting beliefs. Beyond, it's my fault because other people's fault, God's fault. There's the feeling of anxiety about who will take care of me because I was at the mercy of this history. And I'm powerless and helpless. I have no control over what was going on. And I'm bad, unlovable, unwanted, undeserving, unworthy. Terrible self-esteem erosion there. And then if you have a lot of losses, you feel empty. As a matter of fact, when people feel empty, it's such an intense feeling that they sometimes mistake it for physical hunger, and people will gain weight. So there's the addictive patterning, right? And then there can be other negative emotions, and the anticipatory fear that the negative thing will happen again, so there's a sort of protective clenching and whatnot. But it takes about an hour and a half to treat the part that blocked all the memories by checking, all the aspects of the trauma and releasing them with the right technique. It takes about an hour and a half to 3 hours. And interestingly enough, I typically see a dramatic change in symptoms after the first treatment.
Really? What are some of the most traumatic situations you've worked with in terms of a person's trauma?
Well, I see early childhood neglect and abuse history trauma. I'm sorry to say that's common. I'm very sorry to say that's common.
And again, 1 to 6 treatments, more or less?
Oh, yes, same thing. Same thing. I see people who have had very violent histories, sexual abuse history trauma.
War veterans?
Veterans, absolutely. Bodies hate getting shot at, really. Bodies object to that. So we have military history trauma. I see people who have medical history trauma, being treated for cancer or an autoimmune disease that causes erosion of the body over time is stressful on a daily basis. Can even be brutal. Treatment very, very harsh on the body. So they can have treatment trauma, right?
Okay. Now you've got certain techniques that are useful in rectifying this. Is there anything someone can do at home after you see them? Do you tell them what to do to maintain a healthy state?
That's a very good question, and the answer is no, they don't need to, because it's all gone. Yes, when I say we clear it, I mean we make it gone. It's all gone.
They don't have to change their diet or anything else?
No.
Obviously, they would see things change in their life?
Oh, yeah, they
People
see
they hang out
tremendous
with?
changes. Oh, yes, they
Such
see
as?
tremendous. Yes, the Vietnam veteran that I published on, who was 100% disabled and had brain injury, he quit smoking cigars pretty much after the second session, just cold turkey.
On his own? You didn't
On his
instruct
own,
him,
nope,
just
nothing. Mm-mm.
decided on his own?
After the first session, the insomnia went away. And not only that, but he had bought a house from a woman who continued to live in the house after he bought it from her. She was not a relative, she was not a girlfriend, she just lived in the house. And she didn't pay him rent, and she just took advantage of him. And after the first session, he went home and threw out. Not only that, he had severe brain damage because he'd been shot through the head and had several brain surgeries and whatnot. And he had the look of somebody with brain damage, where his consciousness wasn't here looking at you. It was sort of back behind his head, sort of, he was distant, and he had this sort of red, glazed, watery eyes of somebody whose brain is hurting them. After the first session, that disappeared. And he was doing volunteer work at a food pantry, and they gave him the responsibility of opening and closing the pantry. They gave him the keys after that because he was so present. Oh, now you can take on the responsibility.
Yeah.
So,
Now, do you offer a course in this kind of protocol?
oh, yes, I do. I do a training called Healing from the Body Level Up 1. There are 5 levels of training. And in that training, we teach you the basic protocol and 9 different techniques for clearing a trauma structure. And then I have a 1-day training after that. Sometimes I join it with the 4 days, sometimes it's separate, just to treat history trauma for the PTSD symptomology.
Now, is it open to the public, or do you have to have some practitioner level skill?
Well, yes, level 1 is open to the public because I think everybody should learn the techniques for managing your emotional state.
I agree.
And after somebody has PTSD and I treat them, of course I taught them the techniques while we were doing it. And I tell them, when you go home, if anything traumatizes you in the future, treat yourself immediately so you don't collect, you don't accumulate, right? So I do empower them forward, but everything we've treated up till now is gone, but we don't want to accumulate forward,
Great.
right?
Okay, very, very interesting material here.
Oh, thank you.
For more information, your website, contact info.
Right, my website is www.hblu.org. That's short for Healing from the Body Level Up, hblu.org. And my email is judith@hblu.org.
Good. Now, where are you located?
I'm located in the greater Boston area.
Okay.
And I also work by video Skype and by phone with people all over the world, actually.
You can do the same thing you just did in this interview
Yes.
over Skype or over the phone.
Absolutely. Because the techniques themselves are self-administered. If somebody's going to be tapping on their body to release trauma, they do the tapping on their own body, right? So I just instruct them, they do it. Whether
So-
they're sitting in front of me or they're, on the phone, they're doing the techniques.
It's amazing. So you're very accessible.
I'm very accessible.
Thank God to the internet.
Well, yeah. And I'm, up to date technologically.
Now, have you written any books, or do you intend to?
I have a chapter in Fred Gallo's book. Let's see, what's it called? Energy Psychology in Psychotherapy. And I am writing a book on trauma. It's all on my computer accumulated, and I just have to, edit it up and get it out there. And I write a newsletter. I have published a lot of papers. They're on my website. Some of them I've published in peer-reviewed journals. Some of them I published in journals for the field. And I have a lot of content on my website.
Great. Your website again is
www.hblu.org.